The misuse and addiction to opioids such as heroin, morphine, and other prescription pain medicines is a serious national problem that affects public health as well as social and economic welfare. An estimated 1.9 million people in the United States suffer from substance abuse disorders related to prescription opioid pain medicines in 2013, and 517,000 suffer from heroin use disorders. This issue has become a public health epidemic with devastating consequences, including the rising incidence of newborns who experience neonatal abstinence syndrome because their mothers were using substances while they were pregnant, and the increased spread of infectious diseases such as hepatitis C and HIV. Both prescription opioid drugs such as oxycodone and hydrocodone and heroin work through the same mechanisms of action. Opioids reduce the perception of pain by binding to opioid receptors which are found on the nerve cells in the brain and periphery. The bindings of these drugs to opioid receptor regions in the brain produces a sense of well-being, while stimulation of opioid receptors in the deeper regions of the brain results in drowsiness that can lead to respiratory depression and can also lead to overdosing resulting in death. People who use opioids non-medically may seek to intensify their experience by taking the drug in ways to make it delivered to the brain more rapidly. At least 1,432 retail pharmacies showed questionable activity, and 468 that had tripled the average percentage of prescriptions for commonly abused opioids, in the case of one pharmacy reported by the Detroit News. Medicaid programs, also supported by taxpayers but administered by states, also revealed excessive opioid use and probable fraud. In 2010, 359,368 Medicaid enrollees received an opioid prescription amounting to over 2 million prescriptions, and again suggesting that many prescriptions per patient. In 2009, 41.4% of Medicaid-enrolled women filled an opioid prescription compared to 29.1% of privately insured women, offering further proof that opioid makers are relying on public funds for their sales and profits. While Medicaid programs likely provide generic combinations of the active ingredient oxycodone, hydrocodone to patients, this costs about $28 for a 120-day supply, which taxpayers are still paying at least $56 million for the Medicaid opioid prescriptions. Although opioid medications have a legitimate role in the treatment of acute pain and sometimes chronic pain conditions, it is clear that they are often overprescribed or are prescribed without adequate safeguards and monitoring that their misuse can have devastating effects. This has presented a real dilemma for healthcare providers who seek to relieve the suffering while preventing drug abuse and addiction. However, the easy accessibility of this drug has gotten extremely out of hand. We are in the middle of an opioid and heroin epidemic, which is killing ever-increasing numbers of Americans at an astonishing rate, and nothing seems to be done about it. Nothing seems to be getting done about it, sorry. In 2014, almost 30,000 people died from heroin and opioids, exceeding those who died from car crash incidents during the same year. This is reported by the Centers for Disease Control and Prevention, and according to the National Institute on Drug Abuse, the estimated number of emergency department visits involving non-medical use of opioids increased from 144,600 in 2004 to 305,900 in 2008. Treatment admissions for primary abuse of opioids other than heroin increased from 1% of all admissions in 1997 to 5% in 2007 to 2010. Prescriptions for opioids have risen by 300% over the past 10 years and fed the heroin epidemic as the tolerance of opioid addicts surpasses their allotted prescription dosage. Most people know that there is a prescription painkiller epidemic underway, but few realize how much the government is enabling it, how much taxpayers are subsidizing it, and how this is the root cause for the current epidemic. All this talk about how research is the most critical component in squashing this epidemic is just words. Actions speak louder than words, and very few actions have been done to do anything about this problem. The government needs to stop enabling this disease and needs to take control of it.